Hi viewers, welcome back. My name is Adeola Fayehun. Now, while the war against the insurgency Boko Haram continues, right now we like to focus on the state of the displaced people. It is believed that at least 3 million people have been displaced by Boko Haram. But right now we like to talk about about 1.5 million of them that are internally displaced in Nigeria, and so many of them are scattered across various IDP camps across Nigeria. Now, to talk to us about the state, their welfare, what's been happening with them is none other than Philip Obaji, who's actually an activist as well as a contributor at the Daily Beast. Mr. Phillips, welcome to Sahara TV.
It's a pleasure, Adeola.
Hi.
Nice to have you.
Thank you for coming. I just wanted you to know that that was a great article that you wrote, by the way, stating that the Nigerian government had turned its back on Boko Haram. And, you know, just reading the article, I was really touched by many things. But just to start out, for our viewers that may not know the state of some of these people at the IDP camps, you made mention the fact that some of these camps have no basic amenities like running water or electricity, and that most of them are overcrowded. So if they don't have running water or electricity, what do these people have? What has been provided for them?
Well, that's the question. How do they survive? You know that many of these camps are abandoned government buildings. Some of them are schools that have been shot because the government is preempting attacks by the insurgent group Boko Haram. And, you know, education in the first place in Nigeria has been, you know, pathetic. Many schools on their own have no electricity, no running water, no good decks and what have you. And these are the same facilities that the government is using to accommodate these internally displaced persons. So it is pathetic. And most times, you know, the IDPs depend on what is brought to them by humanitarians. What organizations have donated, that's where they get water from. Sometimes they have to go far to get water. But not in all camps, though. There are some camps where the conditions are better than some, but not in any way near perfect. So it is a huge concern, cause for huge concern. And the internally displaced persons in the Northeast are really crying for help.
And yourself have been to many of these camps. I'm just wondering how you felt when you left after seeing the condition of the people.
As part of my first visit to a few camps in Maiduguri was in November of 2014. And at that time, there was an outbreak of cholera in Maiduguri. And in many of these camps, many people, many displaced persons, were suffering from this disease. So I couldn't even get close to this IDPs because I was told if you get close, you're not feel some bit of relief. I needed to know exactly how they felt. I couldn't get very close because of, you know, their plight, because of what they were suffering from. And up till now, many of these IDPs still can't get access to the best health care. Not to say, yes, it doesn't mean that it is all around. There are some camps where, you know, the medical personnel are doing their best. There are government medical personnel trying, you know, to cater for these IDPs. In certain camps, particularly the unregistered camps, you have no access, or these IDPs have no access to some basic amenities. They have to fend for themselves. You know, they have to struggle to survive. They have to struggle to feed. So that's what these IDPs face in many camps.
I see.
Some camps have.
Some camps have what?
Some camps do have, you know, some level of, well, I say care, some level of support, so to speak.
Okay.
Government have done some things in certain camps, and there are certain camps where donor agencies and humanitarian organizations have focused on. But there are many, hundreds of thousands of IDPs, you know, still struggling to find an adequate camp where they can be well catered for. And also, you know that many of these camps are overcrowded.
Yeah.
So
And I'm glad you made mention of the fact that it's not all the camps, but at the same time, we're talking about hundreds of thousands of people. And in your article, you made mention of the fact that some of these camps are now closing down. And I'm wondering what the provision is for the people, because they're basically going back to their homes that had been destroyed by Boko Haram.
That's right. In a place like Adeola State, for instance, in the northeast, the government said a lot of these facilities have to be used. You know that many of these facilities are school facilities. So the schools are about to resume, and some schools have resumed already. So these schools are returning back to their owners. So the government is saying that Adeola, to some extent, is relatively safe from the Boko Haram insurgency. And they said but two local governments, Michika and Madagali, are free from the insurgents. So it's safe to go back. But then the question is, what happens when eventually these people return to these camps and then Boko Haram strikes again? So that's the question. And from what we have seen of Boko Haram, we really know how to throw their bombs again.
So you don't know if they're giving them anything as they're going back, or whether there's any safety measures being put in place for these people as they're going back to their homes?
Well, initially the government said that they were going to have to rebuild the social facilities like schools and hospitals and what have you before these IDPs return to their home communities. But up to now, I haven't been told that any of these things have been done.
I see.
And then we were told that, none of these things have been done as we speak.
I'm
not too sure.
I was going to ask you, because in your article you made mention of the fact that some of these victims at the camps were actually women and children that were recently rescued from Boko Haram. And it was sad to read that at least 2 of them had tested positive to HIV at the camp. So I wanted to know if there's any kind of treatment for these ones at least. And my other question was going to be any safety measure for them going back home, and I feel like you answered that.
In fairness to NEMA, that's the National Emergency Management Agency, who caters for these IDPs. A lot of these IDPs have been catered for. Like, for instance, the Gary 1 camp that has a lot of sick people, or that has 2 patients who tested positive for HIV, they were catered for. Okay. And in other camps around Yola, the capital of Adamawa State, many of these IDPs that took ill have been catered for in hospitals and right in the camp.
That's good.
But the concern is, these people are asked now to leave camp or leave these camps and return back to their host communities. So many people are asking me, how do you cater for these people going back? And the government have offered to support these people in terms of transportation and foodstuff. But from what I gathered, a lot of these IDPs have returned without this transportation from government. And
without transportation fare?
Yes, without transportation fare from government.
They returned without transportation fare?
Yes. I also do know that the government did provide some sort of foodstuff in some host communities. But what I cannot confirm right now is if most of these IDPs who left Yola, for instance, and returned back to the IDPs, to their host communities, have gotten anything in terms
that
of
was promised
food and
to them.
Support from the government. That was promised, yes.
I see.
At the time that article was written, many of these IDPs had said that they had not gotten anything from government. And I'm not so sure if anything has changed.
I see. And the article was written recently. I mean, it was published June 18 or something. So
that's right. And,
I just wanted you to shed some light to something that I read that was very shocking to me. I read in the article that there's child trafficking going on. That hundreds of young girls have been trafficked. And not only that, there had been cases of rape at the camp, and that some of the children have been sold as domestic workers. Does NEMA know about this as well as SEMA?
Well, there was a report from an Abuja-based International Center for Investigative Reporting, ICIR, that alleged that hundreds of young girls have been trafficked from IDP camps. And the report also quoted an unnamed nurse as saying that many children were brought to a hospital after being raped in the IDP camps. And she also said that refugees were being sold as unpaid domestic workers, repeatedly, and in some cases burned and wounded with knives. Well, this report was from, like I did say, was from an independent body. The Nigerian government said that they will investigate this report to find out.
So the Nigerian government has heard about this report?
Yes, they have.
Okay.
And they said they were going to investigate this. But we haven't heard yet if they are actually investigating this report and what they have come up with. So that's it. No one has said anything about, from the government angle, what they have made of this report. But we've had people also say that, yes, a thing like this has happened. We've had people, some IDPs say, well, this could have happened, or a little bit of this has happened. But from the government side, nothing has been stated yet. And we're still waiting to hear from the government whether or not, they think that this report from this organization is actually correct.
I see. To so many people that may be watching this, a lot of people are probably upset and feel like the Nigerian government is wasting time. If anybody, like individuals, are trying to help out these internally displaced persons, is there any way of reaching them?
Well, there are many people helping us, actually. There are many organizations helping out, except for government. Humanitarian bodies, both locally and internationally, have stepped in. And I know that some key organizations like UNICEF, like the Red Cross, have been down. The UNDP have been working in terms of catering for pregnant women in these camps. And they authorize the major body coordinating these camps is the National Emergency Management Agency at NEMA. And they have support from the state emergency management agency in the respective states, like in Borno State, like in Adamawa State, like in Gombe State, and more recently in Kaduna State and in Zamfara State. We had camps, the NEMA had camps.
I see. So
Kaduna.
Other people that are willing can just try to reach out to these camps and they'll be able to help them.
Yes, directly to these camps. These camps are operational. They can write through NEMA. They can go through humanitarian bodies, already stationed, yes. Or they or travel directly to these camps and get in touch with the camp commandants and what have you.
I see. Mr. Philip Obaji, thank you so much for joining us today and updating us about what's been going on with the internally displaced persons.
Thank you, Adeola. It's my pleasure.
Thank you. All right, viewers, that has been Philip Obaji. He's an activist as well as a contributor at the Daily Beast. And I'm sure that you've really enjoyed his analysis of the internally displaced persons across Nigeria. Stay tuned, we have much more to come.